What drew you to a career in operation theater nursing?
From an early age, I had a deep interest in healthcare and the impact it has on improving people's lives, but it wasn't until I first observed an operating room that I truly found my calling. The precision, teamwork, and intensity of the surgical environment captivated me. I realized that as an operating theater nurse, I could play a critical role in helping patients during some of the most vulnerable moments in their lives. The combination of technical skill and patient care, along with the need for attention to detail and quick decision-making, aligned perfectly with my strengths and interests. In the operating theater, every action matters, and the team works cohesively towards a single goal, ensuring the safety and successful outcomes for patients undergoing surgery. This environment allows me to be both highly organized and empathetic, providing hands-on care while maintaining focus under pressure. Knowing that my role directly influences the patient's recovery and comfort gives me a deep sense of purpose and fulfillment. The dynamic nature of the role, where every day brings new challenges and learning opportunities, keeps me motivated and committed to continuously improving my skills. Ultimately, the desire to support patients through critical phases of their medical journey, while being part of a team that strives for excellence, drew me to this specialty in nursing. I see it not only as a career but as a way to make a meaningful difference in people's lives, ensuring that they receive the highest standard of care when they need it most.
Can you describe a challenging situation you faced in an operation theater and how you handled it?
One of the most challenging situations I've encountered in the operating theater occurred during a complex surgery where a patient began experiencing unexpected complications. The patient's blood pressure dropped rapidly due to excessive bleeding, and the situation became critical in a matter of moments. As an operating theater nurse, my role in that moment was crucial, as the surgical team relied on my swift actions to help manage the situation. First, I stayed calm and focused, which is vital in high-pressure environments like the OR. I immediately communicated the changes in the patient's vitals to the surgeon and anesthetist, ensuring that everyone was aware of the situation. Simultaneously, I prepared additional blood products and medication that might be needed to stabilize the patient. I worked closely with the anesthetic team to administer fluids and blood, while also ensuring that the instruments and equipment were ready for any further interventions required by the surgeon. Throughout this, I constantly reassessed the patient's condition and adjusted my approach based on the real-time feedback I received from the monitors and the medical team. Clear communication and teamwork were key. I relied on the close collaboration between the surgeon, anesthetist, and the rest of the nursing team to navigate the situation efficiently. While the complication was unexpected, our collective preparedness and ability to work under pressure allowed us to stabilize the patient and complete the surgery successfully. Afterwards, we conducted a debrief to review what had happened, discuss our response, and identify areas for improvement. This reflective practice is something I value greatly, as it ensures that we continually learn from challenging situations and enhance our ability to provide the highest standard of care in the future. Handling such critical moments has strengthened my ability to remain composed under stress, work seamlessly with the team, and ensure patient safety in even the most difficult circumstances.
How do you ensure patient safety and prevent complications during surgical procedures?
Ensuring patient safety and preventing complications during surgical procedures is at the core of my responsibilities as an operating theater nurse. It begins with thorough preparation before the patient even enters the operating room. I carefully review the patient's medical history, surgical plan, and any relevant tests or lab results to identify potential risks, such as allergies or pre-existing conditions that could complicate the procedure. By being fully informed about the patient's background, I can anticipate any issues and prepare accordingly. Before the surgery begins, I actively participate in the preoperative safety checks, such as the World Health Organization (WHO) Surgical Safety Checklist. This involves verifying the patient's identity, confirming the procedure and surgical site, and ensuring all required instruments, equipment, and medications are available and functioning correctly. These routine checks are crucial to preventing avoidable errors, such as wrong site surgeries or equipment failures, which could compromise patient safety. During the surgery, maintaining a sterile environment is one of my top priorities. I follow strict aseptic techniques, ensure that all members of the surgical team adhere to sterilization protocols, and continuously monitor the sterile field to prevent contamination. At the same time, I closely observe the patient's vital signs, working in collaboration with the anesthetic team to detect any signs of complications, such as abnormal heart rhythms or changes in blood pressure. By identifying early signs of trouble, we can act swiftly to mitigate risks before they escalate. Communication is another critical aspect of ensuring patient safety. Throughout the procedure, I maintain clear, concise communication with the surgeon and the rest of the team, ensuring everyone is aware of any changes in the patient's condition or any equipment issues. This coordination allows us to respond immediately if any complication arises, whether it's a technical problem or an unexpected reaction in the patient. Finally, post-operative care is equally important. After surgery, I ensure that the patient is monitored closely in recovery, checking for any early signs of infection, bleeding, or adverse reactions to anesthesia. By following comprehensive post-operative protocols and educating the patient and their family about signs to watch for, we help prevent complications even after the surgery is complete. In summary, patient safety is ensured through a combination of meticulous preparation, adherence to safety protocols, constant monitoring, effective communication, and diligent post-operative care. These measures, taken together, minimize the risk of complications and ensure the highest standard of care for every patient.
What is your experience with using specialized equipment and technology in the operation theater?
Throughout my career as an operating theater nurse, I've gained extensive experience working with a wide range of specialized equipment and technology, all of which are essential for ensuring successful surgeries and patient safety. This exposure has allowed me to develop both a strong technical skill set and a deep understanding of how to use these tools effectively in various surgical contexts. One of the key pieces of equipment I frequently work with is the surgical diathermy machine, used for cutting tissue and controlling bleeding during operations. My role includes not only setting it up but also adjusting its settings according to the specific requirements of the surgeon and the type of procedure. Ensuring that the machine functions properly, and monitoring its use to avoid tissue damage or burns, is critical to maintaining patient safety. I also have experience with anesthesia machines and patient monitoring systems, which play a vital role in managing the patient's vital signs during surgery. I work closely with the anesthetic team, ensuring that the monitors are providing accurate real-time data on the patient's heart rate, oxygen levels, blood pressure, and other key indicators. My familiarity with these systems allows me to quickly recognize abnormalities and alert the team to any issues that need immediate attention. In more complex cases, I've assisted in surgeries involving advanced technologies such as laparoscopic towers for minimally invasive procedures. These systems require precise coordination, from setting up the camera and instruments to troubleshooting any technical issues during the surgery. My role includes ensuring the surgeon has a clear visual field and that the instruments are functioning correctly, which is crucial for maintaining the flow and accuracy of the procedure. Another important aspect of my experience is with sterilization equipment, such as autoclaves and sterilization indicators. Maintaining a sterile environment is critical in preventing infections, and I've gained a solid understanding of how to operate and monitor sterilization processes to ensure that all instruments are prepared according to hospital standards. Beyond using the equipment itself, I'm also diligent about regularly inspecting and maintaining the devices. Ensuring that all technology is in optimal working condition before a surgery starts is part of my routine, as it helps prevent delays or complications during the operation. In short, my experience with specialized equipment and technology in the operating theater has equipped me with the skills to operate and manage a variety of tools critical to successful surgeries. My hands-on knowledge allows me to contribute to the smooth flow of surgical procedures, ensuring both precision and safety throughout the process.
How do you handle emergency situations in the operation theater?
Handling emergency situations in the operation theater requires a combination of quick thinking, composure, and effective teamwork, all of which are essential to ensuring patient safety in critical moments. In my experience as an operating theater nurse, I've developed the ability to remain calm under pressure, prioritize actions, and respond efficiently when unexpected events occur during surgery. When an emergency arises, such as sudden bleeding, a drop in blood pressure, or a cardiac arrest, my first priority is to maintain focus and keep communication clear within the surgical team. One of the key aspects of managing emergencies is ensuring that all team members are aware of the situation and that everyone knows their role. I immediately alert the surgeon and anesthetist to any changes in the patient's condition, such as abnormal vital signs or unusual bleeding, while also quickly preparing the necessary equipment or medication that may be required to stabilize the patient. Simultaneously, I adhere to established protocols for handling emergencies, such as advanced cardiac life support (ACLS) protocols, if necessary. For example, in the event of a cardiac arrest, I ensure that the resuscitation equipment, including defibrillators and emergency drugs, are readily available and properly prepared. I support the anesthetic team in managing the patient's airway and assist the surgeon with any additional interventions needed to control the situation, such as managing hemorrhage or adjusting the surgical approach. During these critical moments, clear communication is essential to ensuring that the team remains coordinated and responsive. I focus on providing concise updates about the patient's status and ensuring that any changes in vital signs or equipment are immediately communicated to the relevant team members. This helps the surgical team make informed decisions quickly, whether it involves continuing the procedure, altering the surgical plan, or stopping the surgery to stabilize the patient. In addition to managing the technical aspects, I am also mindful of the emotional dynamics in the operating room. Emergency situations can be highly stressful for everyone involved, so maintaining a calm and composed demeanor helps to reassure the team and keep everyone focused on their responsibilities. This is especially important in ensuring that panic does not set in, which could compromise the efficiency and safety of our response. After the emergency is resolved, I am actively involved in the post-event review or debriefing, where the team discusses what happened, how it was managed, and what improvements can be made for future emergencies. This process is crucial for continuous learning and for refining our ability to handle emergencies more effectively. In summary, my approach to handling emergencies in the operation theater is centered on remaining calm, acting decisively, and ensuring clear communication. By staying focused and following protocols, while also supporting the surgical and anesthetic teams, I help ensure that we can manage critical situations effectively and ensure the best possible outcomes for the patient.
What is your experience with scrubbing in for surgical procedures and assisting the surgeon?
Throughout my career as an operating theater nurse, I have gained extensive experience in scrubbing in for a wide variety of surgical procedures and directly assisting surgeons. Scrubbing in requires strict adherence to aseptic techniques, which is fundamental to preventing infection and ensuring a sterile environment for the surgery. Before scrubbing in, I carefully follow the standard protocol for hand hygiene and gowning to maintain sterility. I also ensure that all necessary instruments, supplies, and equipment are prepared and laid out in an organized manner on the sterile field. This preparation is crucial to supporting the surgeon's workflow, as it allows for a smooth and efficient procedure. I anticipate the surgeon's needs, ensuring that the required instruments are ready at each stage of the operation, whether it's passing the scalpel, forceps, or other specialized instruments. During the procedure, my primary role is to assist the surgeon by providing the right instruments, maintaining the sterile field, and, in many cases, aiding with tasks such as retracting tissue, suctioning fluids, and controlling bleeding. This requires not only technical precision but also a deep understanding of the procedure itself, as I need to anticipate the next steps based on the surgeon's actions and the progress of the surgery. By doing so, I help facilitate a seamless operation and minimize any disruptions that could affect the patient's outcome. In more complex surgeries, such as orthopedic or cardiovascular procedures, my responsibilities may include more advanced tasks like managing surgical devices, assisting with suturing, or positioning equipment such as retractors to optimize the surgeon's visibility and access to the surgical site. I am also attentive to maintaining communication with the anesthetic team, ensuring that any changes in the patient's condition are addressed promptly. In addition to assisting during the surgery, I play a key role in monitoring the sterility of the operating field. This means ensuring that no breaches of the sterile barrier occur and addressing any potential contamination immediately. If any part of the sterile field is compromised, I take immediate action to correct it, whether by replacing contaminated instruments or adjusting my own positioning to maintain sterility. My experience also includes a variety of surgical specialties, from general surgeries such as appendectomies and hernia repairs to more specialized procedures like laparoscopic surgeries, orthopedic reconstructions, and gynecological surgeries. Each type of surgery comes with its own set of challenges and specific instruments, which has allowed me to develop a strong adaptability to different surgical environments and procedures. Overall, scrubbing in for surgeries and assisting the surgeon requires a high level of precision, anticipation, and communication, all of which I have honed over years of practice. My focus is always on providing the best possible support to the surgical team, ensuring that the procedure goes smoothly, and maintaining the highest standards of patient care and safety throughout.
How do you ensure a sterile environment in the operation theater?
Ensuring a sterile environment in the operation theater is one of the most critical aspects of my role as an operating theater nurse, as it directly affects patient safety and helps prevent infections. I follow strict protocols and adhere to established aseptic techniques at every stage of the surgical process, from preparing the operating room to post-surgery procedures. The first step in maintaining a sterile environment begins with thorough preparation of the operating room. Before the patient and surgical team enter, I ensure that all surfaces, equipment, and instruments are properly sterilized according to hospital guidelines. This includes using high-level disinfectants, autoclaving surgical instruments, and ensuring that sterile drapes and covers are in place over equipment in surgical tables. I also check the sterility indicators on all packaged instruments to confirm that they have been appropriately sterilized. When scrubbing in for surgery, I strictly follow hand hygiene protocols by performing a surgical scrub for the recommended duration, ensuring that my hands and forearms are thoroughly cleaned. After scrubbing, I gown and glove using aseptic techniques, making sure to avoid any contact with non-sterile surfaces. The proper donning of sterile attire is essential to maintaining a sterile field during the procedure. Once the surgery begins, my role is to constantly monitor the sterile field. I ensure that all instruments, materials, and equipment introduced into the field are sterile. For example, I inspect each sterile pack and instrument for integrity before passing it to the surgeon. If any instrument or surface is accidentally contaminated, I immediately remove it from the field, replace it with a sterile alternative, and take the necessary steps to re-establish sterility, such as redraping or replacing contaminated gloves. Maintaining a sterile environment also involves close monitoring of the surgical team's actions. I ensure that all team members adhere to aseptic techniques, such as avoiding contact with non-sterile areas and maintaining proper positioning to prevent contamination. If there's any risk of a breach, I address it right away to avoid compromising the sterile environment. For instance, if someone accidentally touches a non-sterile surface, I alert them and assist with regloving or gowning as necessary. Another important aspect of maintaining sterility is controlling airflow and managing traffic in and out of the operating room. I ensure that doors remain closed and limit the number of people entering or leaving the room during surgery, as unnecessary movement can introduce contaminants. Proper ventilation systems are also crucial in minimizing airborne bacteria, and I make sure these systems are functioning effectively. Post-operatively, I carefully handle used instruments by following decontamination and sterilization procedures to prepare them for future use. I also ensure that any waste, such as contaminated dressings or disposable instruments, is disposed of in accordance with infection control guidelines. In summary, ensuring a sterile environment in the operating theater requires diligent preparation, constant monitoring, and strict adherence to aseptic techniques. By staying vigilant and promptly addressing any potential breaches, I help create a safe environment that minimizes the risk of infection and promotes successful surgical outcomes.
What is your experience with monitoring vital signs and managing hemodynamic instability during surgery?
Throughout my experience as an operating theater nurse, monitoring vital signs and managing hemodynamic instability during surgery has been a critical aspect of my role in ensuring patient safety and successful outcomes. I work closely with the anesthetic team to continuously monitor key vital signs, such as heart rate, blood pressure, oxygen saturation, and respiratory rate, and I remain vigilant for any signs of instability that could indicate complications. Monitoring vital signs begins as soon as the patient enters the operating room. I assist the anesthetic team in connecting the patient to monitoring equipment, ensuring that the devices are calibrated and functioning properly. These monitors provide real-time data, allowing us to track the patient's cardiovascular and respiratory status throughout the procedure. My responsibility includes not only observing these vital signs but also recognizing early warning signs of hemodynamic instability, such as significant changes in blood pressure or abnormal heart rhythms. One of the most critical challenges during surgery is managing hemodynamic instability, which can occur due to various factors like blood loss, fluid shifts, or anesthesia-related issues. In situations where the patient experiences a rapid drop in blood pressure or an arrhythmia, I act swiftly by notifying the anesthetist and the surgical team, ensuring everyone is aware of the patient's condition. Effective communication is crucial in these moments, as it allows the team to make quick decisions about the appropriate interventions, such as administering fluids, medications, or adjusting the anesthetic. In cases of significant blood loss, for instance, I help prepare and administer intravenous fluids, blood products, or vasopressors as directed by the anesthetic team. I also assist with ensuring that the patient's fluid balance is maintained, helping to prevent shock or other complications. Additionally, I monitor for signs of inadequate perfusion, such as changes in skin color, temperature, or urine output, which could indicate worsening instability. My experience also involves responding to more acute emergencies, such as cardiac arrest or severe hypotension during surgery. In these situations, I help initiate resuscitative efforts, which may include administering medications like epinephrine, assisting with chest compressions, or preparing the defibrillator if needed. Following advanced cardiac life support, ACLS, guidelines, I ensure that all necessary equipment is readily available and that the team works in a coordinated manner to stabilize the patient. Post-surgery, I continue monitoring vital signs in the recovery room, where patients are still at risk of developing hemodynamic instability as they recover from anesthesia. I keep a close eye on their cardiovascular status and respond to any fluctuations in vital signs, ensuring that they are stable before transitioning to the next phase of care. In summary, my experience with monitoring vital signs and managing hemodynamic instability during surgery involves constant vigilance, technical expertise with monitoring equipment, and a deep understanding of physiological responses during surgery. By staying alert, communicating effectively with the anesthetic and surgical teams, and responding promptly to any signs of instability, I help ensure that patients remain stable and receive the appropriate interventions when needed.
How do you handle emergencies such as cardiac or respiratory arrest in the operation theater?
Handling emergencies like cardiac or respiratory arrest in the operation theater requires a swift, coordinated response and a calm, focused mindset. Over the course of my career as an operating theater nurse, I have been trained in and experienced responding to such critical events, ensuring that the patient's safety is prioritized while the surgical team works to stabilize the situation. When a cardiac or respiratory arrest occurs, the first step is to remain calm and alert the surgical team immediately. Clear communication is critical in these moments, as the entire team needs to be aware of the situation and ready to act. I quickly inform the surgeon, anesthetist, and other team members of the arrest while also calling for assistance, as managing such emergencies often requires additional support. For a cardiac arrest, I follow Advanced Cardiac Life Support, ACLS, protocols. My role often involves assisting the anesthetic team in initiating life-saving interventions, such as chest compressions if required, and preparing the necessary emergency equipment, such as defibrillators and emergency drugs. I ensure that the defibrillator is set up and ready for use if indicated, and I assist with delivering shocks as needed under the anesthetist's or team leader's guidance. If the patient requires immediate medication, such as epinephrine or amiodarone, I prepare and administer these drugs as directed, all while continuously monitoring the patient's vital signs. In the case of respiratory arrest, I focus on airway management. Working closely with the anesthetist, I help secure the airway, which may involve providing manual ventilation via a bag valve mask or assisting with intubation to restore the patient's ability to breathe. I also ensure that oxygen delivery is optimized, and that the patient's oxygen saturation levels are closely monitored to prevent hypoxia. During these critical moments, I maintain constant communication with the anesthetist, providing updates on the patient's condition, such as changes in heart rate, blood pressure, or oxygen saturation. This helps the team make informed decisions quickly, whether it involves continuing resuscitative efforts or transitioning to more advanced measures to stabilize the patient. Aside from the technical aspects, effective teamwork is essential in managing such emergencies. Everyone in the operating room has a defined role, and my focus is on ensuring that my tasks, whether it's handling the equipment, preparing drugs, or assisting with resuscitation, are completed efficiently, allowing the rest of the team to concentrate on their specific duties. Once the patient is stabilized, I help with the transition to intensive post-operative care, ensuring the patient is transferred to the recovery room or intensive care unit under close observation. After the emergency, a debriefing with the surgical team is usually conducted to review what happened, discuss our response, and identify any areas for improvement. This reflective practice is vital for continuous learning and for ensuring that we can respond even more effectively in future emergencies. In summary, during cardiac or respiratory arrest in the operation theater, I act quickly to assist in resuscitation, working closely with the anesthetist and surgeon, following ACLS protocols, and ensuring that emergency equipment and medications are readily available. My ability to remain calm, communicate clearly, and execute my role efficiently helps ensure that the patient has the best possible chance of a successful outcome during these life-threatening situations.
What is your experience with managing blood products and transfusion reactions?
As an operating theater nurse, I have extensive experience in managing blood products and handling transfusion reactions, both of which are crucial in surgeries where blood loss is significant or when the patient's condition requires immediate intervention. My role in this area involves not only the safe administration of blood products but also ensuring that all precautions are taken to minimize the risk of transfusion reactions and addressing them swiftly if they occur. Before administering any blood product, I adhere to strict protocols to ensure patient safety. This begins with verifying the patient's identity, blood type, and cross-matching results with the blood product to be administered. This double-check process, often conducted with another nurse or member of the surgical team, is essential in preventing transfusion errors. I also ensure that all necessary documentation is completed and that the blood products are stored and handled correctly, adhering to proper temperature control and expiration guidelines. During surgery, if blood transfusion is required, I work closely with the anesthetist and surgeon to monitor the patient's condition before and during the transfusion. This involves preparing the blood products, setting up the infusion, and administering the blood under controlled conditions. I carefully monitor the patient's vital signs, such as heart rate, blood pressure, oxygen levels, and temperature, before, during, and after the transfusion to detect any early signs of a transfusion reaction. In the event of a transfusion reaction, immediate action is critical. Reactions can vary, ranging from mild allergic reactions to more severe issues like hemolytic reactions or transfusion-related acute lung injury, TRALI. If I notice any symptoms such as fever, chills, hypotension, shortness of breath, or back pain, I act swiftly. My first step is to stop the transfusion immediately to prevent further exposure to the incompatible blood product. I then alert the anesthetist and surgeon, ensuring they are aware of the situation so that we can begin managing the patient's reaction. Depending on the severity of the reaction, I follow specific protocols, which may involve administering medications such as antihistamines, corticosteroids, or epinephrine to control symptoms. I also maintain intravenous access to provide fluids or medications and assist in stabilizing the patient's condition. Oxygen therapy may be initiated if respiratory distress is present, and I continue to monitor the patient closely throughout the response. Once the patient is stabilized, I document the reaction in detail, including the time, symptoms, and interventions, and ensure that blood samples are taken to investigate the cause of the reaction. I follow hospital procedures to report the transfusion reaction to the blood bank and any relevant regulatory bodies for further analysis. Additionally, I ensure that any unused blood products are returned to the blood bank and that they are not used on other patients. Managing blood products and transfusion reactions is not limited to emergencies, it also involves preventive measures. For example, I am vigilant about pre-transfusion assessments, particularly for patients with a history of transfusion reactions. I coordinate with the anesthetic team to ensure that patients receive pre-medication when necessary, such as antihistamines or steroids, to reduce the risk of a reaction. In summary, my experience with managing blood products and transfusion reactions involves meticulous attention to detail, from verifying blood compatibility to closely monitoring for and responding to adverse reactions. Through adherence to safety protocols and effective communication with the surgical team, I ensure that blood transfusions are carried out safely, and that any complications are managed swiftly to protect the patient's well-being.